My name is Beatriz Sparks and I work at Cooperative Health Center. Good morning, my name is Beatriz. I'm one of the nurses at Cooperative Health Center. I understand that you're here to talk about some birth control methods.
Yes, ma'am.
Okay. And I just want to make sure you know that the conversation that we have here today, whatever we talk, is confidential. Unless you tell me that somebody's hurting you, you are hurting somebody, or you are going to hurt yourself. Okay, in that case, I will have to report that to somebody else so they can get you the help and the support that you need.
Sure.
Do you understand that?
Yes, ma'am.
Okay. And can you tell me what behaviors are must report?
If I'm hurting somebody, somebody's hurting me, or I have plans to hurt myself.
Okay. And can you tell me what kind of birth control method are you looking for?
I would like to get something long-term.
Long-term, okay. I have a chart here that will help me to explain to you this, the different things we can offer you. Tier 1, we have the implant, is good for 4 years. Hormonal IUDs, we have some from 3 to 6 years. And then we have the non-hormonal IUD, which is good up to 12 years. We also have sterilization methods in case of the female tubal ligation and male vasectomy. Okay. The effectiveness is very high. It's 1 woman out of 100 will get pregnant with one of these methods.
Okay.
Then we have the tier 2. With the tier 2, you will need to put more effort from yourself. We have the birth control pills. You will have to take them every day at the same time.
Mm-hmm.
The patch, you will have to change it every week, but you have to monitor it every day to make sure it's in place. Then we have the ring, which will be placed every 4 weeks, and you will have to do it with your fingers.
Mm-hmm.
Okay, you will learn to do that.
Mm-hmm.
Then we have the shot. It's good for up to 3 months, and you will have to go to a doctor's office to get the shot.
Okay.
The effectiveness of these ones are 6 to 9 women out of 100 will get pregnant in 1 year.
Mm-hmm.
Okay, so it's less effective. Then we have tier number 3. On tier number 3, we have the withdrawal method, which requires more effort from you and your partner.
Okay.
So let's say your partner will have to pull the penis before ejaculation, and it has to be done away from the vaginal and anal area.
Okay.
You have the fertility awareness method. You will have to know when you're ovulating so you can avoid having sex during those days,
Mm-hmm.
so you don't get pregnant.
Okay.
We have the burial methods. These are condoms, internal condom and a condom. They're very good to prevent STDs,
Mm-hmm.
and the effectiveness on these methods is of course lower. And 12 to 24 women out of 100 will get pregnant.
Mm-hmm.
Okay, so those are the things that we have. So which are the most effective from what you see here?
The first tier.
Okay, so any of this. Okay, then I'm also going to go over something that is important.
Mm-hmm.
It's emergency contraception in case you have intercourse without protection.
Mm-hmm.
Okay, so we have 2 pills. Ella requires a prescription,
Mm-hmm.
and Plan B does not require a prescription. You can get it over the counter.
Mm-hmm.
But both of them have to be taken within 5 days of having unprotected sex.
Okay.
Then we have the IUD, Paragar IUD. It's 100% effective, but you also have to get it placed within 5 days. And you have to go to a provider's office, a healthcare provider's office, to have that.
Okay.
To have that done. Okay. Now, do you have any specific birth control in mind?
Yes, ma'am.
Which one?
I like the implant.
The implant?
Mhm.
Okay. The implant is a good choice. It's good for 3 to 4 years. No one will be able to see it, and it's part of our most effective methods from tier 1.
Mm-hmm.
Okay. You can remove it at any time. You don't have to wait for the 3 years.
Okay.
Is there something specific that you like about the implant?
Yes, ma'am. That is a long-term method.
Okay,
Mm-hmm.
very good. I'm going to explain to you what it is, how it works, how effective it is, the side effects, the warning signs, and the advantages.
Okay.
We're going to go over all that.
Okay.
Okay. I just want to make sure that you know that at any time
Mm-hmm.
you can stop me if you have any questions or you want me to repeat something. So feel free to do that.
Okay. Mm-hmm. Sure.
So what would you do if you don't understand something?
I can stop you at any time and ask my questions.
Great. Okay. So what is the Implanon? The Implanon is a small plastic rod. It's this one right here. You can touch it. Okay. It's very flexible.
Mm-hmm.
It is placed under the skin in the inner upper part of your arm, right here. Okay.
Mm-hmm.
Prevents pregnancy for 3 to 4 years.
Okay.
It only has one hormone and it's progestin.
Mhm.
Patients that cannot take estrogen can use the implant, okay?
Mhm.
What hormone is released in the implant?
Progestin.
Okay, very good. It's very important that you know that the implant prevents pregnancy. It's very good at it, but it does not protect you from STDs. So every time you have sex, you have to use a condom to protect yourself from STDs.
Sure.
Okay. So I have a question for you. Will you be protected from STDs if you use the implant?
No.
What do you need to do?
Use condoms.
Okay, very good. How it works? It works mostly by keeping the egg from leaving the ovaries and keeps the mucus of the cervix thick, preventing the sperm from getting into the uterus and meeting the egg. If there is no egg to meet the sperm, a female cannot get pregnant. Okay, and you can see that here. This is the uterus, okay? This right here, this glands, the cervical mucus is going to be right here. So the sperm comes to the vagina and won't be able to go to there. Okay, so that's a good picture to show.
Right.
How does the implant prevent pregnancy?
It keeps the eggs from leaving the ovaries and keeps the mucus of the cervix thick.
Okay. Very good. Now the effectiveness is 99.95% effective, and that means that 1 woman out of 100 will get pregnant when using the implant. Okay. Can you tell me how many users that are using the implant will get pregnant in a year?
Just one.
Just one. Okay, good. How it is used? Well, first you have to talk to your healthcare provider. Your healthcare provider will go over your medical history. You have to make sure to tell him all the medications you are taking, if you're taking any medications. You also have to make sure that your provider knows if you have any history of breast cancer, liver disease, and if you have any vaginal bleeding for not known reason. Those are very important. Okay. If the implant is right for you, if your provider decides that, then it will be placed on your non-dominant arm, meaning that if you are right-handed, it will go into your left hand. If you are left-handed, it will go into your right arm. Okay. I'm gonna just show you something. Okay. When you are about to get it, the provider will ask you to lay on a examining table. You will lay on your back and you will raise your arm, exposing the area where the implant is gonna be placed. The provider will measure the area. Okay, it will measure and mark where it's going to be placed. After it's placed, they will put a small band-aid. After they put a small band-aid, you will be able to palpate the implant to know where it is. Okay, after that, they will put a large band-aid just to protect it. And you can remove that large bandage 24 hours later. You can remove the small bandage 3 to 5 days later. Now, you do have to keep that area dry and clean to make sure you don't get any infections. Okay? Now, there's one more thing that is very important for you to know. Depending on the time when they place the implant, the time during your cycle, then you may need a backup method. And that's something that you will discuss with your provider. Okay, so I just want to make sure, do you understand that? Is the implant effective right away?
No, ma'am.
Okay, good. That's very good. I'm going to ask you another question. Where will the implant be placed?
In my arm.
Okay, it goes
Under.
under the skin. Okay, and just remember that it's under the skin or under the muscle.
Okay.
Now the removal date, it's very important. It's 3 years after the date that is placed. There are ways for you to remember that date. You can have a calendar, you can have a phone app that will send you a message close to the date when it needs to be removed. There's different ways, so just keep in mind that. Okay. You can also keep the information card of the implant, and the information card will tell you the insertion day, so you will count 3 years after that. And it also will give you the date when it should be removed. Okay. Now, when you are close to do that, you have to make sure that you call your provider's office and let them know that you want to remove it. You have to know whether you are going to have another implant inserted or you're going to change another method. Okay? So I'm going to review some of the information. How can you remember the date that you have to remove the implant?
I can use a phone app, a calendar, or I can call the provider's office.
Good. Yeah, that's another one too. Yeah, you can call the provider's office.
Okay.
And the other thing is, what is important for you to, why is it important for you to call 2 to 3 weeks ahead of time?
So the provider can replace the old implant, or he can give me another method.
Okay, good. Yeah, because if you don't, as soon as the provider removes the implant, you can get pregnant the same day that they remove the implant. Okay, just want you to be aware. So you will be further right away. Okay. How can you prevent pregnancy after removing the implant?
Using another method.
Good. So you keep that in mind. Okay. If you miss the removal date, if you forgot to replace the implant on time, you can get pregnant. Okay, that's another thing that you need to know. Call your provider to have the old implant removed and a new put in. Okay. And if you had sex after your removal date, you can ask for emergency contraception. Okay. And what will you do if you miss the removal date?
I can call the provider so he can place a new implant.
Okay, good. Now we're going to go over the side effects. The most common one is irregular bleeding. Okay, and that's because of the progestin in the implant. After 3 to 6 months, the bleeding may become more regular, lighter, and less crampy. Okay, so that is the good thing about it. Okay, you may have some spotting in between periods, and you may not know when your period is going to come. How do you think you feel about having no periods?
That's fine for me.
How do you feel about having spotting, for a while and not knowing when the spotting is coming?
I think that's okay too.
Okay, I just want to make sure you know that if you are not happy with your irregular bleeding, you can talk to your provider. He can give you something to help with that problem. Okay. Then there's other side effects. Some of them are common and are acne, headaches, and depression. There's other ones that are less common, not very often. Breast pain or tenderness, stomach pain, nervousness, painful periods, or nauseous. Okay. Can you just tell me the most common side effects?
Headaches, depression, or acne.
Very good. Now there are complications, of course, but they're very rare. But this is when you call your provider. I want to make sure you do understand this, and I'm going to give you this for you to take. Okay. This paper right here. The implant may not be placed correctly, or it may come out of your arm, and you will know that if you palpate it, it's not there. So if it's not there, you can get pregnant, so you have to call your provider right away. The infection, okay, there's a possible infection on the site where it was placed. You will look for redness, swelling, tenderness, or heat. If you have any of those signs, you have to call your provider right away. And then the other one, it's also even, rare as well. It could break. It's very rare that happens, but of course you will have to call your provider. Okay. So what are some possible complications or warning signs that will prompt you to call your provider right away?
If I don't feel the implant in place, if I have signs of the infections, or if the implant is break.
Okay, very good. Is there anything, based on the information I gave you, is there anything that you like the best about the implant?
Yes, I like it because it's a long-term method and it has progestin good for 3 years. I know that I can have some irregular bleeding too. Okay, good. And there's some advantage, okay, on top of that, what you just told me. It's an excellent at preventing pregnancy. Using it doesn't interrupt sex, so that is a good thing. It is simple to have it placed. Once it's placed, you don't have to worry about anything. That's a good thing. It's very safe to use, and it can be used by those who can't use estrogen. It usually prevents menstrual cramps. That's a good thing too. Many patients don't get a period at all or bleed rarely when they are on the implant. Okay. Is there anything that you do not like about the implant? No, sounds good.
Okay, so do you want to start with the implant?
Yes, ma'am.
Very good. Is this the method that you want to use?
Yes, ma'am.
Very good. So we're gonna just, go over the information to make sure you understand very well, okay? Tell me, what do you know about the implant? What have you learned with this?
That is progestin, good for 3 years. I can have some irregular bleeding, and it goes under my arm,
Great.
under the skin.
Okay, good. And how does the implant work?
It keeps the eggs from leaving the ovaries and keeps the mucus of the cervix thick.
Very good, okay. And how will you take care of your arm the week the implant is placed?
Dry and clean.
Okay, good. And why would you do that?
To keep my implant.
But mainly it's to prevent infection.
Oh, prevent infection.
Yeah, just make sure you remember that. You want it clean and dry to prevent infections.
Okay.
And just tell me real quickly, what is one sign of an infection?
If I see redness or it feels hot.
Good, okay. How will you remember to have the implant taken out in 3 to 4 years?
I can use a phone app, a calendar, or I can call the doctor's office.
Okay, very good. And what warning signs will you report right away to your provider when you're using the implant?
If I have signs of infection, if I don't feel the implant in place, if I cannot feel it.
Right. Okay. So what I'm going to do now, I'm going to give you extra information here. This is in writing. Okay. This is more detailed information about the Nexplanon. The implant is the Nexplanon. Okay. That's the name of the actual device. And this is a little card that also gives you some information. Okay. And I'm also going to give you the warning signs and what you should do about that. Okay. So we have, these are the warning signs. Okay.
Thank you.
So you can have that information for yourself and read it anytime you want to, and I will inform the provider that you are ready. They will have you sign a consent form, and you can change your mind if you want to, or pick a different method. You are free to do that.
Thank you.
Okay. Well, thank you very much.
You're
It was
welcome.
nice meeting you.
Nice meeting you.